After selecting the appropriate syringe size, open the syringe package with the clear plastic side on a flat surface. Connect the syringe and the vial adapter by twisting the tip of the syringe and the small end of the vial adapter together. Make sure to grasp the vial adapter by the sides and do not touch either end of the vial adapter. Leave the blue syringe cap in the packaging for later use. Remove and discard the vial top. Disinfect the top of the vial with an alcohol wipe. Place the vial on a flat, hard surface. Hold onto the vial and insert the vial adapter into the rubber stopper of the vial and turn the vial upside down. Make sure the prong of the vial adapter remains inside the medication. Hold the vial adapter and the syringe in one hand and use your other hand to pull back the plunger to withdraw the medication. You'll see that the Biojector syringe size is printed below the dosage marks on the syringe to help ensure you're using the correct syringe size. When drawing in the medication, the solid red ring on the plunger should be just below the desired dosage mark. If you see air bubbles in the syringe, an additional hint to dislodge them is by using the rapid pull-push method. Do this with the syringe still connected to the vial. For medication that foams easily, allow a few seconds for the medication to settle. Disconnect the vial adapter and the syringe by holding on to the sides of the vial adapter. Twist and pull the syringe to separate it from the vial adapter, leaving the vial adapter in the vial. Then dispose of the vial and the vial adapter in an appropriate container. If your facility is not using a vial of medication with a standard 13mm enclosure, or if you are using a multi-dose vial, you may opt to attach your own fill needle for drawing in medication. The last step before placing the blue syringe cap on the syringe is to make sure there is no air at the tip of the syringe. Excess air can cause an increase in bleeding or discomfort and can make the dosage inaccurate. To expel any remaining air, gently twist the plunger until you see a drop of liquid. Place the blue syringe cap on the syringe to prevent touch contamination. Finally, insert the filled syringe into the Biojector. Align the syringe with the tabs on the Biojector. Never press the actuator without a syringe filled with liquid locked into the device. Push down and turn the syringe about a quarter turn clockwise to lock it into place. Check the syringe lock indicator window to make sure it is green. Now you're ready to give an injection. Because the Biojector 2000 is different from traditional syringes in many ways, it's helpful to explain the differences to your patients. That way, they understand the benefits of the technology and they know what to expect from needle-free delivery. For example, when you explain that the dispersion pattern is wider than with a needle and syringe, patients understand that there might be a slightly larger red area after the injection. Assure your patient that this redness is temporary. Be sure to tell your patients that the Biojector makes a sound, like opening a can of soda as the injection is given, that all injections involve a sensation, and some medications may cause slight burning or stinging. Choosing the correct injection site is critical to achieving the expected results with maximum comfort. For better medication dispersion and patient comfort, it's important to administer the injection into the body of the muscle. For intramuscular injections, the usual sites are the deltoid, dorsogluteal, and vastus lateralis. Refer to your provider or institutional policy on injection site selection. For subcutaneous injections, it may be helpful to move the tissue mass forward. This will also make the injection more comfortable. The usual subcutaneous injection sites are the dorsal and lateral areas of the arm, the lower parts of the abdomen, and the anterior fleshy parts of the thigh. Once you've chosen the proper site, prepare the skin for the injection by disinfecting in an outward circular motion with an alcohol wipe. Allow the alcohol to dry completely. If the site isn't dry, the alcohol may sting the patient during the injection, the device might slip, or the site might not be completely disinfected. Remove the blue syringe cap. Have a gauze pad or cotton ball ready to apply immediately after the injection. Stabilize the patient's arm or leg firmly with your free hand. Be sure to immobilize the site to prevent sudden movement during the injection. Push the Biojector syringe very firmly against the site at a 90-degree angle perpendicular to the skin. Medication that enters the skin diagonally and not straight through the skin may cause more tissue trauma and splashback. Apply enough pressure to achieve a dimple effect. This will spread the skin taut, stabilize the site, and allow for a more comfortable injection. To promote muscle relaxation, ask the patient to take a deep breath. Then, while they are exhaling slowly, administer the injection by firmly pulling the actuator back and releasing it in a quick, smooth motion to prevent wasting CO2. Do not move the Biojector while delivering the injection. You will hear the CO2 exiting the back of the Biojector after the injection. Continue pressing firmly against the skin, maintaining the dimple. This helps minimize discomfort and bruising. Don't move the Biojector until you count 1001, 1002, 1003. Immediately after the injection, apply firm pressure with 3 fingers at the injection site for 1 full minute to minimize bleeding and bruising. Because of the wide dispersion pattern, it is important to use 3 fingers to completely cover the injection site. Hold pressure longer for individuals with blood clotting deficiencies. Do not rub or massage the injection site. This can cause bruising. After 1 minute, remove the pad. You will see a temporary circle pattern on the skin from the firm pressure of the syringe. You may also see a drop or two of blood, which is normal. Apply a bandage over the site if needed. Finally, remove the used syringe by pressing down and turning it counterclockwise 1/4 turn and dispose of it in an appropriate container. Remember, proper injection technique is essential in administering an injection with the Biojector. Most issues can either be eliminated or minimized by following each of the proper steps exactly. Please review steps in giving an injection with the Biojector 2000. After reviewing your technique, if you are still experiencing frequent bruising, bleeding, or increased discomfort, there may be other possible causes. For instance, rubbing the injection site can increase the likelihood of bruising. Remember, you only want to apply pressure at the injection site, never rub. For individuals with blood clotting deficiencies or those who are taking anticoagulant medications, hold pressure longer than a minute at the injection site with 3 fingers. Actually, pressure can be held for several minutes. For individuals with small or atrophied muscles, move the muscle mass forward. For individuals with minimal adipose tissue, move the adipose tissue forward. Individuals who move or jerk away during the injection are more likely to experience bruising. That's why it's important to always stabilize the injection site. If the syringe does not easily insert, or you are unable to lock it into the Biojector 2000, the syringe lock indicator ring may be out of position. Locate the inner ring on the inside of the Biojector collar. The notch of the inner ring should be aligned with one of the grooves in the collar. Gently nudge the inner ring to the Biojector collar grooves. The Biojector 2000 has set a new standard for comfort, safety, and convenience in needle-free delivery of intramuscular and subcutaneous injections.